Hello and welcome. Today, we're diving into a complex group of neurological disorders known as leukodystrophies, with a specific focus on their impact on the auditory nerve pathways and potential visual consequences. Leukodystrophies are rare, genetic conditions that primarily affect the white matter of the brain, and understanding their intricacies is crucial for early diagnosis and potential intervention. Leukodystrophies are fundamentally genetic in origin. They arise from mutations in genes responsible for the production or maintenance of myelin, the protective sheath that surrounds nerve fibers in the brain and spinal cord. These mutations disrupt the normal development or function of myelin, leading to its breakdown or abnormal formation. Each type of leukodystrophy is associated with a specific gene mutation, and inheritance patterns vary, ranging from autosomal recessive to X-linked. The underlying problem in leukodystrophies lies in the white matter. As the myelin sheath is damaged, the nerve signals are transmitted slowly or not at all. When the auditory nerve pathways are affected, the transmission of sound information from the ear to the brainstem and eventually the auditory cortex is compromised. The visual consequences arise from damage to the optic nerve, optic radiations, or visual cortex. This demyelination causes progressive neurological dysfunction, as the brain struggles to process information correctly. The inflammation and gliosis that accompany demyelination further exacerbate the damage. In the context of vision, the inflammation along the optic pathway directly impairs visual signals, potentially leading to blurry vision, optic atrophy, or visual field defects. Leukodystrophies are rare disorders. Their exact prevalence is difficult to determine due to the number of different types and challenges in diagnosis. Estimates suggest they collectively affect approximately 1 in 40,000 live births, though specific types can be much rarer. They can affect individuals of all ethnic and racial backgrounds, but some types are more prevalent in certain populations due to founder effects or specific genetic predispositions. The signs and symptoms of leukodystrophies are highly variable, depending on the specific type of leukodystrophy, the age of onset, and the extent of white matter involvement. Regarding the auditory pathways, individuals might experience progressive hearing loss, difficulty processing auditory information, or central auditory processing disorders. Visual symptoms can include declining visual acuity, optic nerve atrophy detected through eye exams, nystagmus or involuntary eye movements, and, in more advanced cases, blindness. Other common symptoms include developmental delays, motor difficulties such as spasticity or ataxia, cognitive decline, seizures, and behavioral changes. The combination and severity of these symptoms vary greatly from person to person. Diagnosing leukodystrophies typically involves a multifaceted approach. This often begins with a thorough neurological examination and a detailed medical history. Magnetic resonance imaging, or MRI, of the brain is crucial, as it can reveal characteristic white matter abnormalities. Genetic testing is essential to confirm the specific type of leukodystrophy and identify the causative gene mutation. Evoked potentials, including auditory brainstem response ABR and visual evoked potentials VP, can assess the function of auditory and visual pathways, respectively. Other diagnostic tests may include blood tests to measure levels of certain enzymes or metabolites, as well as nerve conduction studies to assess nerve function. Leukodystrophies encompass a wide array of specific disorders, each with its own genetic cause and clinical presentation. Some of the more common types include metachromatic leukodystrophy, or NLD, adrenoleukodystrophy, or Ave-Krab disease, also known as globoid cell leukodystrophy, and Pelizaeus-Merzbacher disease. Each of these has unique characteristics, but all share the common feature of white matter dysfunction. Some can be further classified based on the age of onset: infantile, juvenile, or adult, reflecting the varying rates of disease progression. Currently, there's no cure for most leukodystrophies. Treatment focuses on managing symptoms, slowing disease progression, and providing supportive care to improve quality of life. Bone marrow transplantation, or hematopoietic stem cell transplantation, has shown promise in slowing the progression of some leukodystrophies, particularly when performed early in the disease course. Enzyme replacement therapy is available for some types, like certain forms of MPS disorders that can cause leukodystrophy. Physical therapy, occupational therapy, and speech therapy can help maintain motor skills, communication abilities, and independence. Medications may be used to manage seizures, spasticity, and other symptoms. Genetic counseling is essential for families affected by leukodystrophies. Since leukodystrophies are genetic disorders, primary prevention isn't currently possible. However, genetic counseling and carrier testing can help families understand their risk of having a child with a leukodystrophy. Prenatal testing may also be an option for families with a known genetic mutation. Early diagnosis and intervention are crucial for optimizing outcomes and providing supportive care. The prognosis for individuals with leukodystrophies varies greatly depending on the specific type of disorder, the age of onset, and the severity of the disease. Some types progress rapidly, leading to significant disability and a shortened lifespan, while others progress more slowly. Recent research efforts are focused on developing new therapies, including gene therapy, which holds promise for correcting the underlying genetic defects. Clinical trials are ongoing for various leukodystrophies, offering hope for improved treatments and outcomes in the future. There is ongoing research focusing on newborn screening for earlier detection of some leukodystrophies to improve outcomes with timely intervention.